I was just telling Brooke about this MMA fighter. I don't know if anybody watched the fight, but this girl got pummeled, and she went from, she's, good looking girl.
Yeah, she's pretty.
Girl. And in the second picture at the end, her forehead, she looked like, what was the name of that character? It's like the blue guy.
Oh, the Megamind.
Megamind. That's what she looked like when she was done. She looked like Megamind.
It's actually a really great movie.
Poor thing. I just worry about her brain. I'm like, oh my God, like she for sure had major concussions. Had to have.
Oh, yeah.
Yeah.
Concussion and CT is a big thing right now.
Ooh. Yeah, it's bad.
That's something we can segue into.
Yeah.
I was like,
there we go.
That can be our starting.
Yeah.
Yeah.
Hey guys. Welcome to Between the Reps with Brooke and Gina.
Yeah, welcome back. We are accompanied with Ernesto Medina.
That's me.
It's my new chiropractor.
Mm-hmm.
And more than chiropractic. So I think we told you we were going to have him on. I've been training over at CrossFit Currahee with my friend Marissa Wise, and she had been talking to me.
But still a huge avid fan of CrossFit West.
Yes, I mean my home gym.
Like, don't forget us.
My home gym is CrossFit West in Santa Cruz.
Sorry, put you on the spot.
Still a huge fan.
Yeah, a huge fan of CrossFit West.
And for those of you that know or my history, I guess, I have a lot of nerve damage, and it causes a lot of. I mean, I deal with things. Primarily, I notice it with like my grip, or even, and not just in training, sometimes holding things or picking stuff up around my house or in my car, or I drop shit all the time.
Yeah.
And I was training, and I had just been talking to Marissa about a lot of stuff about like my sleep and like my nerves and all this stuff. And she kept talking about her chiropractor I should go see, who does a lot of stuff with neurological, I guess, rehab or issues and things like that. And so I finally started to go see Ernesto, and it was great. And we have been wanting to have someone on to talk about all this type of stuff.
Yeah.
And
so
we got him.
So we got him.
Here.
It worked out.
Yeah, and we're going to have him back for many more times to talk about specific topics.
You do more than chiropractic, right?
Yeah,
yeah. Brooke was saying you do. It's kind of like wellness, all over wellness.
Yeah. So
stuff.
the big focus of my practice now has become functional medicine and neurology, neuro rehab based things. But I am a chiro, so my bread and butter is chiro stuff. But I integrate, like you noticed, Brooke, a lot of neurological testing into my chiropractic workup, especially if there's numbness, tingling, weakness, and grips, things like that. Those are things we have to evaluate to see how well the sensory and motor system in the brain is working or not.
Okay.
So just give us a quick, I guess, doesn't need to be quick.
We got an hour.
Just background on you. I guess, so like when you decided you want to go to school for that, and maybe a little background on like if you played sports. I know you had said we were sharing injury stories, battle wounds basically, because Gina noticed that my blood blisters are looking better and my rope burn
because they were bad
is finally healing. And he has a nose injury because he went to a double day. Was it, you do it 2 in one day or just
sometimes double days, sometimes just back-to-back training sessions.
And jiu-jitsu.
Yeah. But I do CrossFit also. I CrossFit at CrossFit Currahee. Ever since they opened up that location about 3 years ago. So since I've been there since they opened up, I have a really good relationship with Todd, the owner, and Marissa. I've been working with Marissa for the whole 3 years that I've known her. I'm doing different blood chemistry stuff, optimizing gut function, looking for overtraining patterns, making sure we get control of that. But my background, going on my 9th year of chiropractic, did just the chiropractic for about 5 years and got bored, to be honest. In Silicon Valley, a lot of chiropractic is neck pain, back pain, right?
Right.
You have the desk jockeys, the
nerds.
the nerds.
We're fucking nerds.
And they don't work out, right? I mean,
it's funny because it's true.
I'm a nerd. I'm a nerd.
I mean, it is true. They sit at a desk, 8 to 10, 12 hours a day, don't exercise.
Right.
And they don't know why their neck hurts or their back hurts. And you tell them, well, you need to get active and exercise. And they're like, no, I don't want to do that. I want you to fix my pain.
It doesn't work that way.
No, it doesn't work that way. And so working with athletes has always been my passion. A lot more fun, different injuries. So not the common neck pain, back pain. And so because I was in training jiu-jitsu during chiropractic school, I was CrossFitting a little bit at the time. Those became my patient base, right? So unique injuries, which is fun.
Which probably makes you have to sort of, like, you're constantly learning too.
Absolutely.
Like going back to try and figure things out.
Yeah, especially if it's a really unique injury that I haven't seen before. So how are we going to work through this and learn from it? A lot of learning from it. So 5 years in, I finally had some money in my pocket to go back to school, right? Invest more money into education.
Right. Yeah. More student loans.
More student loans.
Yeah.
And I
rack those up.
Right?
Yeah.
It never ends, it seems like.
Right.
So I started a postgraduate program in neurology, which was a passion of mine, working with a lot of concussion, post-concussion syndromes, early onset dementias, things like that. And so I got involved in this program, and it turned out you need to know the nutritional piece to really rehabilitate a brain properly, right? If the brain is missing nutrients or fatty acids or amino acids, whatever it may be, you can try to rehab the brain all you want, but you're not going to get much progress. So then I had dive down the rabbit hole of functional medicine. And,
so then I went and got a nutrition. No,
clinical nutrition
right.
and that whole world. So integrating the two together has been my path over the last, 3.5 years.
Very cool.
Yeah.
Yeah.
So that's essentially what I do mostly with the CrossFitters now. Minimal chiropractic, because to be honest, at our gym, when I first joined, I think we had like 4 or 5 different chiropractors training there.
Oh,
right.
Right. Here, I got to find my niche.
Right. Essentially, yeah. To market yourself,
right.
And be different from the rest. I never talked about chiropractic. I talked about, optimizing gut function and cortisol and inflammation and things like that. And so Todd and Marissa always started referring patients to me who fell in that spectrum of things.
Which is probably more people.
Yeah.
Yeah.
It kind of is. Yeah. And then the musculoskeletal stuff that comes up, I tell them, send them to the other guys, right? To share the wealth, right? Kind of thing.
Right.
So yeah, that's my background there. And that's what I've been working on the last few years.
How old are you?
I'm 33.
He's a baby.
How many chiropractors have you seen, Gina?
Just one. I got in a car accident years ago. I was like 23, I think, and went to a chiropractor after that. But that's my only experience with it.
Well, how was your experience? I always like to ask that question because I always get mixed reviews.
I mean, I eventually felt better, but I was like 3 times a week, and then it was 2 times a week. And then it was, I felt like, I had to finally, I'm like, a year later, like I felt fine for a while now, maybe. So, that's obviously my only experience with it.
Yeah.
So yeah, I haven't gone. I hurt my back a few years ago, and it just kind of eventually kind of healed itself on its own. But I tried like a bunch of different things, but I didn't do chiropractic. I did like acupuncture and a bunch of other stuff, but I don't, I don't know if, it felt like it was working, but I don't know. Yeah. I don't know. Eventually healed up. So
yeah, the car accident situation is a unique situation because if there's attorneys involved, if there's it's an open personal injury case, car insurance is involved, they kind of have to see you frequently, or the car insurance says, well, you're not that injured.
I see.
We don't really need to pay your visits. Right. So it gets kind of tricky. But to be honest, it's also can be a good money maker for the chiro.
Yeah. Well, yeah, it kind of felt that way.
Yeah.
After a while. And I remember saying like, I was down to like once a week, and it was like, really almost a full year of it. And I was like, I felt better for about 6 months. Yeah. I think, maybe I'll just like call you on like a as needed basis, and didn't need it after that. So so that was my experience with it. And obviously that was just one person. It's not like I think all chiropractors are,
Yeah. Oh yeah. That's I always like to ask because I always hear across the spectrum.
Sure.
I have people come in.
It's like anything in any field.
Oh yeah.
Yeah.
Sure.
can't judge them all.
Have you, I mean, I'm sure you've heard this, but I remember when I was like growing up, because my parents went to the chiropractor. I remember hearing, and it's probably more of a negative connotation.
I don't know.
Connotation.
Thank
Whatever
you. We
he
have
said.
a smart person here. Thank God.
That like once you start adjustments, you will always need them. I remember hearing that. Like if you once you start, you'll never to not be able
it's
to
like
do
now
them again. You'll need it.
Right.
Is there truth to that?
Well,
They
as far as I'm concerned, no.
And
not after a year.
Yeah, it was fine. And that was, years ago.
I think part of that comes from how chiropractors are trained in school. You got the hardcore chiropractors who say the saying is from the womb to the tomb, you should be getting adjusted. I don't fall into that belief. I'm all about empowering people to learn how to work through their injuries themselves, right? You have ROMWOD, you have foam rolling, you have rehab. So if you know how to work through an injury, you shouldn't need me all the time. If you can't work through an injury, if it's lingering 2-3 weeks and you just can't figure it out, then come back, we'll work through it, and then you're on your own again, type of thing. That's my belief.
Yeah. So you should probably, like, as a patron of a chiropractor or a patient, probably ask them about their philosophy about that before.
Yeah, that's
maybe.
a good point.
What would you say are
Interview.
some really good questions people should be asking their chiropractor?
Oh man, that's a good one.
Maybe like help them find like the right person.
Yeah, that's a good question. Ooh, a lot of chiros might hate me for what I'm gonna say.
That's okay.
I don't think we have too many chiropractors that listen to this.
You'll get more business by just being honest, I feel like.
Right? That's a good point.
Yeah.
One being, the common ones are going to be how long is it going to take for you to fix me, right?
Mm-hmm.
That's a common question, and really, we don't really know. I always tell people I don't know.
Right.
Everybody responds differently to care. So it could be 1 or 2 sessions. It could be a couple weeks.
Sure. Well, and like you said, it's probably outside factors too.
Outside factors.
Yeah, like
said,
what
their
are you willing to
nutrition
do
and
on
their
your own time?
working out.
What's your activity level?
Right.
Do you train 4 or 5 hours a day?
Yeah. If I ask you to do these things at home, are you actually going to do them?
Right.
Because if you're asking me,
yeah, you're not a witch
Busted.
doctor. You're not going to yeah, you are busted. Are you doing anything that I've asked you at home? No.
So that could be another big question. Are you going to give me homework or exercises to do as a patient to better my situation? That would be a big one to ask.
Sorry.
just
I
flip
know.
that
I know.
button
I
on
did.
the side.
I did. Sorry.
So
Totally
that'd be
you.
the big one. And then am I going to have to keep coming back forever?
Right. Right. Yeah. Yeah.
So
Am I on the 5-year plan?
Yeah.
Yeah.
Those would be big questions for sure.
Does my insurance cover it? No.
I'm out of network of all insurance. So I don't work with any insurance.
Yeah.
And that actually gives me the freedom to do what the patient needs most, instead of what insurance is going to pay for and how much time I can allocate per person.
Mm-hmm.
Because I'm out of network, they don't control my treatment plan for a patient.
Right.
So it gives me a lot of freedom.
Nice.
I had a question and I forgot.
Oh,
I know. And it could be too. It could be like the way chiropractors were trained so many years ago versus maybe how schooling looks like when you went through school. Because I imagine that's probably got to be different, right?
Different, yeah. And school to school is also very different in their core philosophy too.
Do you think there's any adjustments that maybe we used to see a lot more of on a regular basis that now you don't do unless it's really necessary? Because I could think like my parents, right? Like when they would go to their chiropractor, maybe they would, you go and it's like, you already know exactly what's going to happen when you go. It's like, I'm going to go to the chiropractor and they're going to do this, 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 and this.
Yeah.
And now it's because like when I come and see you, it's like, what are your ailments? Right. Like you kind of sit down and you're like, let's kind of figure this out. Like how much time do we have too? And you don't just adjust me. Yeah. Like, you don't even adjust me unless like you like something is definitely out of place. Right. It's, you do like soft tissue work, Graston, some release
You're not just cracking
Active
necks.
release. No.
Yeah.
Cracking necks.
Right.
Cracking necks, cracking backs.
Writing
Right.
checks. Oh, what did Nico said?
Cashing checks.
Yeah,
Cracking necks
Nico
and
said
cashing checks.
snapping necks and cashing checks.
Yep.
That's about right.
No, for you especially, we want to see what your goal is for that visit, what your issues were in training the week prior, to work through those for your training sessions going into the next week. So it's always a purpose. There's always a goal in what we're doing with you each session. The soft tissue, a lot of soft tissue, especially for athletes. Soft tissue, I think, is a big place of injury, right? So just adjusting doesn't address soft tissue injury, in my opinion. And so a lot of what we do with you and other athletes is a lot of soft tissue, and then the adjustments kind of the bread and butter on top of that.
What do you think would be, what is the strangest ailment that you've had that's come in that's like, because, you know, most people go to, like you said, a chiropractor for like, my neck hurts, my back hurts.
Yeah.
You know what I mean? Like
Sure.
and if it encompasses other things that it can heal or help to heal, what would be some of those things?
Or maybe something that you really had to sort of like go, maybe like not like go back to the books for, but like really had to like do some
think back,
research for
sure,
you.
sure.
Yeah.
So yeah, that's a good question. Because I have this unique niche of functional medicine and neurology, the tough kind of chiro cases end up being neurological based cases. So usually brain based cases.
Okay, so neurology for dummies.
So I'll give you an example.
What would that?
I was actually thinking about this on the way over. So I have a patient later this afternoon I'm going to see. She's an older lady. She slipped and fell in a big department store. And when she fell, she caught herself and just tore her rotator cuff, just ripped it apart. And so before she got surgery, they sent her to physical therapy for like 3 months. No improvement. Things got worse. Finally, they did a surgery, repaired her rotator cuff. Comes out, again, rehab, post-surgical rehab. Again, the rehab makes her worse. In fact, the pain has gotten so bad, it's not only in her shoulder, it radiates into her face, into her ear, into her head, and her eye swells shut.
Jeez.
And when she walks too much, the simple impact of the ground vibrating up through her spine will cause her ear to swell. Her eye to swell.
Oh, wow.
Shut. And so she got referred to me, and so I start working her up. And, well, right off the bat.
When she came in and starts trying to explain this to you, what were you just like?
What the?
So when that happens, right away my chiropractic hat comes off and my neurology hat comes on. Because it doesn't make sense chiropractically, right?
Right.
Physical therapy was focused on the shoulder, and it wasn't doing anything. It was making it worse. So then I have to take a step back and say, well, what underlying what is happening for her to have referral into her face, into her eye. Even she couldn't feel like the inside of her cheek, and like when she would chew, she felt like she didn't have sensation of the right side of her cheek and her teeth. Like she would chew on the other side.
Yeah.
And so right off the bat, I know there's a sensory issue. The brain isn't perceiving sensation of the organs of the hand and the arm and the shoulder, and it's meshing with the face, right? So a simple example, right? Neurology for dummies, like you said.
Yeah. Thank you.
Phantom limb pain, right? Someone loses a limb, but they still feel pain in that limb. They still feel an itch in that limb.
I had that. I still
lost
get
a
it
limb?
sometimes. No. Yeah, this is we grew
bionic. It's a bionic arm.
No,
That's
but when
stem
I
cell is
when I,
good.
when I,
Wow,
when I di-
it just grew from a stump. You just have this little tiny hand, and it just.
like what's that? Deadpool?
Yes.
When he loses his legs,
Yes.
he's growing his
my
legs
God,
back.
Yes. Oh, that's what I imagine.
No, but I've had like from like my neurological stuff, like having like phantom itching
Yeah.
in like weird spots down my arm.
And you can't itch it. That would be miserable.
Well, you have that phantom itch.
I do. I have an itchy shoulder.
She has an
do.
itchy shoulder.
I do. I have an itchy
She
shoulder.
doesn't.
I don't
It's like,
know where.
she's
Why?
just itching it, and
Yeah,
it's
all
like
the time.
nothing's there.
Yeah, maybe
You
you,
can't
can
find
fix
the
that
spot,
for me.
and you
No,
can't find where the
no,
itch-
I itch it, and it's like, where is it?
It might be your foot.
Yeah, yeah. I'm
be.
just itching different parts of me, trying to
Right.
figure it out.
Right. So the brain
Yeah.
has a map. They call it a homuncular map. And that map is basically where different body parts are organized, right? So the shoulder can overlap with, something, the elbow.
Okay.
Right? So scratching the elbow might help your shoulder.
Huh.
For example, the feet and the genitals are right next to each other.
So I should itch my genitals to get rid of my shoulder.
Your feet.
Just
Or
scratching
something
my
like
crotch
that.
all the time.
Right?
What are you
I went
doing?
straight for the crotch.
Sorry, this is in my this is my homework.
I'm just doing my physical therapy at home.
Right.
Yeah.
Your homework. I mean,
Me and my vibrator.
I mean,
This is physical therapy, Ruby. I'm done telling my daughter in the next room.
That's not what it looks like.
Physical therapy.
That's not what that looks like. That's actually that is a rehabilitation tool. Ruby.
Yeah, that's not what you think it is.
I mean, that actually exists for like bladder incontinence issues.
Really?
Right? Yeah.
Huh. I should not have any bladder incontinence issues.
I've
should
heard
definitely not be peeing with double unders.
I haven't heard like specific stories, but I know that there are some females that I know like in the sport of CrossFit that have like have lots and lots of problems with like their pelvic floor.
Yeah. Yeah.
And do all kinds of therapy.
Therapy.
There you go.
I put my dog in the kennel and she's losing her mind right now.
She is.
That is actual therapy. Yeah.
Gina, have you still been using Beachbody?
I absolutely have. My favorite lately has been the yoga.
And why are you doing yoga?
I'm trying to get really zen and for maybe like a yoga class, when I go to Jamaica.
Yep.
When you take me to Jamaica.
I've gotten Gina into yoga class one time and she swore she would never go back. So now she's doing it in the comfort of her own home.
Yeah, the cool thing about Beachbody though is that they're, some of them are only like 10 minutes long. So like when you're really crunched for time, you can just,
do something.
Yeah. And we talk about trying to stay motivated and trying to do things with kids and, in between and all of that. So it works really well for that.
Yeah, it's on demand. It's easy. And you stream it. It has a streaming service, so you can get on your phone, TV, iPad,
you can
laptop.
do it anywhere, and you don't even need equipment.
Nope. A little history on the company. It was behind P90X, Insanity, and 21 Day Fix. Those have all been really successful workouts. My sister did P90X for a long time. In fact, she probably still does.
Yeah.
Yep.
It works. Well, this works.
Yeah. They have hundreds of workouts for all fitness levels. So don't be scared if you're like, maybe you're not really into working out a ton. It's always nice, exactly why Gina's doing yoga at home before we go back to a yoga class.
So I don't embarrass myself.
She can feel more comfortable in class.
And they have everything from bodybuilding to weight training to cardio hit to yoga. Well, we already mentioned yoga, and even have dance workouts because we all know what a good dancer I am. I'm going to work on that at home too.
So right now for our listeners, you can get a special free trial membership when you text REPS to 303030. Again, for our listeners, you can get your free trial membership when you text the word REPS to 303030.
Again, you will get full access to this entire platform for free. All the workouts, the nutrition information, and support, totally free. And all you have to do is text REPS, REPS, to 303030.
For diet, Gina.
Yeah.
You care about the quality of the meat that you eat, right?
Yeah, absolutely. Yeah.
Well, when it comes to meat, quality it does matter. I mean, or I hope that it does matter to all people,
Right.
that eat meat.
Anything you put in your body.
Yeah. And there's more to just, the texture and the taste, where it comes from. Luckily, there's ButcherBox. ButcherBox believes everyone deserves high quality, humanely sourced meat. I feel super confident in companies that, not only believe that, but their actions and their brand and everything is built around it. Every month, ButcherBox ships a curated selection of high quality meat right to my home, to our home. They send it to us. It comes to my home, but we both eat it. All the meat is free of antibiotics and added hormones.
Which is important.
Yeah. Each box has 9 to 11 pounds of meat, enough for 24 individual meals.
Yeah.
So right there, a lot of people you guys would probably think like, I'm not going to do a curated box. It's way too expensive. But
it ends up being like $6 a meal.
Yeah. And you can't pay that anywhere.
No.
It's packed fresh and shipped frozen and vacuum sealed, so it stays that way. And we can speak from personal experience. It is It totally surprised me, actually, how fresh it did not. Once we
it
thawed
doesn't
it,
taste
and
like it's
you
been
grill it, it does
frozen.
not taste like it's been frozen. You can customize your box. Gina, did you know that?
I was such a child.
Wish I could customize my box. or you can just pick one of theirs that's already put together. Either way, you get exactly what you want, and it arrives at the door. Super convenient. You don't have to go to the grocery store. You don't have to deal with.
No-brainer.
Yeah, it's a no-brainer.
So right now, ButcherBox is offering new members ground beef for life. That's 2 pounds of ground beef in every box for the life of their subscription, plus $20 off their first box.
So for life, as long as you continue to order, you continue your subscription.
Subscriber,
Yeah. Free beef.
Free beef plus
Free
$20
ground
off your first box.
Just go to butcherbox.com/reps or enter promo code reps at checkout.
Again, that's butcherbox.com/reps or enter your promo code reps at checkout. Okay, so this woman, sorry, we got you off track.
Right.
I'm
That's our
curious.
MO.
I want to hear. Yeah, I know.
So anyways, when I worked her up, what I discovered was her brain essentially wasn't getting proper feedback from her entire right side. Right?
Okay.
Her entire right arm and her face was basically overlapping together in the brain, and there was no distinguishing between the hand and the forearm, shoulder to face. So that's why stimulating the shoulder, like they were doing TENS at the physical therapy, stimulating the shoulder would shoot pain all up into her face, into her mouth, into her ear.
Horrible.
So
This
one
poor
of
woman.
the really simple tests we did, which we did with you, and you laugh every time we do it, is a finger to nose test, right? So we have them put the hands out.
Oh my God, we should have Gina do it.
I tell them, right, hands out in front of you, close your eyes. Whichever finger I touch is the finger you're going to touch the tip of your nose with, and then you go back. Right?
Okay.
Very simple. And we're looking for a couple basic things. One, can they feel what finger I'm touching? Two, can they find their nose, right? Or are they missing? Are they hitting their eye, hitting over here? Or are they kind of
And that
missing
happens.
and then correcting? Yeah. That's why she laughs every time
Do you
we
pass?
do it.
I do pass, but I've definitely I have some damage.
Okay. She's like,
Right.
Even like speed too,
Yeah,
because
yeah.
that's the thing for me too. Like when you start doing like some of that speed
Yeah,
test, like
yeah.
I like have like one side that will will work, and the one's like
Slow.
slower.
Slow-mo.
Discoordinated.
Yeah.
Is doing
Not
its own
coordinated.
thing.
You're like-
Is doing his own thing. So when we did that, the last thing we looked at, is there a tremor, right? Are their hands shaking at rest, or are they still and then they shake at the end and then go still, right?
Uh-huh.
So that tells us different things about different parts of the brain. But in her case, I would touch her finger. I'd tell her, touch your nose with this finger. And she would say, did you touch my finger?
Oh, wow.
Which one did you touch? And so right off the bat,
Like, is this a joke?
she wasn't feeling what I was touching on her
Yeah.
hand, right? And then we drew letters and numbers, which we also did with you. Can she recognize me drawing a letter and a number on her hand without her looking? And can she identify it, right? Kind of
We
like
used to do
game.
that
Like
as
just like
kids in
this.
church.
Yeah.
Right? Yeah. It's
Yeah.
like a kid's game,
Yeah.
right? But
Yeah.
we're testing to see how well the brain can recognize sensory feedback from the hand.
Huh.
And she couldn't do that either,
Really?
right? So I already knew I could isolate what part of the brain, her sensory part of the brain, wasn't working appropriately. It wasn't getting proper feedback from her entire limb.
Wow.
So it's only been, I think, 3 or 4 weeks now, and all her radiating pain into her face and her ear is pretty much gone now.
Really?
Yeah.
Wow. That is awesome.
And we did simple stuff. All we did was some vibration therapy to the hand
Mm-hmm.
first, and then we slowly built up to the forearm, then to the bicep, then up to the shoulder. I did vibration of her face. I actually put a tongue depressor in her mouth. I had her bite on it on the right side of her face, and I would vibrate the tongue depressor to get feedback through her teeth and her cheek to her brain, so that it isolates the maps in the brain as to what's happening at each individual body part.
Oh, so that they can recognize, okay, that's my face.
Exactly.
That,
exactly.
Yeah, right.
Mm-hmm.
Huh, that's really interesting.
Yeah. It seems overly simple, right?
Right.
But you really have to know the parts of the brain and how to give feedback to those parts of the
So
brain.
just by doing that therapy over and over again, she
Mhm.
should eventually not have that pain at
exactly,
all?
Exactly.
Oh, okay.
Mm-hmm. And we're
Huh.
on the right track. Yeah, we're more than halfway there.
That sounds way less painful than probably her physical therapy she was going through.
Oh, yeah.
Right?
On
Yeah.
like 3 weeks.
Yeah.
Versus
I'll bite down on a
how
tongue
many-
depressor any day than have, you know,
Yeah.
everything cracked and moved and, you know what I mean?
Yeah, so in her case, we didn't even adjust her at first, right? Because it was all sensory feedback we had to do.
Mm-hmm.
The adjustments probably would have made her worse at that moment because she was so fragile. So we've slowly built up to finally being able to adjust her now.
Huh. It's pretty cool.
Yeah.
Well, you keep this going.
Oh,
I'm gonna handle the beast really quick.
Oh man, you just put me on the spot. Will you keep this going?
Yeah. Don't fuck this
I'm
up.
like, oh, what amazing question can I come up with? All right. Well, now I'm on the spot. So how long do you think? So if it's only been like 3 weeks, you said 3 weeks,
3
right?
or 4 weeks. Yeah.
Okay. How much longer do you think it would take for her? I mean, again, there's other
to fully
factors.
recover,
Yeah. I mean, you expect her to fully recover? I mean, is the shoulder still as bad as when it started out? Because like right now you're basically fixing what the other people did, right? And then you probably have to get to the, I mean, does it work in stages like that?
Yeah, absolutely.
Yeah.
So yeah, this is a good question. We have to get to actually rehabbing her shoulder next because she couldn't tolerate that at first.
Right.
I mean, she still has weakness of the shoulder. She still can't fully close her hand. So she doesn't have very good grip strength.
Right.
So that'll be the next phase. Once she's able to tolerate more input into the system, we can start building strength.
Oh, okay. Yeah.
But that would be the next phase.
Right.
So that's probably one of the type of unique injuries that I see.
Yeah.
I have a lot of other cases like that I've seen. But for CrossFitters, which is probably more relative to your population, I do a lot of blood testing. We can do stool testing if that's of interest to them.
That's gross.
It's funny. It's entertaining.
Do you send it in for testing or do you look at it yourself?
No. It's a take-home kit.
Oh.
They send it to the lab.
He's like,
No.
something's definitely wrong here. I know, right?
No, I never see it.
Oh, okay, that's
You
better.
basically take a kit home and you poop in like a hot dog tray.
Sweet. Nice.
You ship it to the
Can I
lab.
get
Nice.
2 of
Yeah.
You get a
So
phone call
gross.
like,
It's like when you get
Wait,
to
wait,
your
Dr.
urine
Dr. Medina, do you want, I send all of it?
I know, yeah. It's like a urine test, right? Like,
Yeah.
you know, like when you fill the cup all the way up and they're like, whoa, whoa, whoa. You know, we don't need that much. Or like a sperm like a sperm count.
Yeah.
You just go in. Like, I remember when Nico was going through that because we had the reversal.
Yep.
And he had to go in and like take it. And he's like, I mean, I don't know. Like, is it gross if I like send all of it or like, you know, like I just need a little bit of it? Be like that with the poop.
It's like they get all of them. They're like, oh,
Overachiever.
you're one of those.
Yeah.
Or they call back and ask, how many samples did you send?
Right. Yeah.
We only needed one sample. That's only one.
I mean, poop can be very different from time to time, you know?
It can.
So,
So if someone was like, I guess we'll talk about CrossFitters. Do they usually come to you and want to talk about gut health, or is that something like maybe you guys discuss based on other things?
Gut health has been popular.
It's
More popular
very
than I thought.
popular right now.
yeah.
Yeah, with people coming in. So that's been a big one. Most of the time, though, like Marissa or Todd will catch wind in one of the classes that one of their members is dealing with something, and they'll talk to them about it and say, you should go see.
Or they smell that they're dealing with something.
Right? And they say,
Hey,
oh,
you
you
might
want
to go see my.
You might need
see
to
my buddy.
get that checked.
Yeah.
Right?
That's not right.
Or for example, they do a nutrition program as well that Marissa runs.
Yep.
Because she's a WAG certified nutrition coach.
Oh, okay.
And sometimes some people just don't fall into the perfect macro counting and getting the best results. And so that's when she thinks, oh, maybe there's an underlying hormone imbalance, maybe a thyroid issue. And so then she'll send them to me. We kind of do a blood test, work them up, find out maybe what the underlying issues are, and then we send them back to Marissa.
So what kind of therapy do you do for gut health? I mean, is it the same sort of thing?
It's all nutrition. It's all nutrition and supplement based.
Okay.
So a big thing is finding underlying food sensitivity issues.
Okay.
Right?
So you're not adjusting or doing anything that's not
necessarily.
Okay.
Unless that's another issue.
Yeah. I know.
There are some gut issues since you started poking.
Yeah.
So there are some more severe gut issues like IBS or something called SIBO. I don't know if you guys ever heard of SIBO. It's called small intestinal bacterial overgrowth.
Okay.
Which is pretty debilitating and severe for a lot of women. And it's just chronic, unrelenting bloating.
Okay.
And they can't control it. They can't figure out what it is. And usually it's very severe constipation that goes with it.
Okay.
And in those cases, there is actually a neurological component to it. So I listen to the stomach. Is there movement? Are the intestines basically contracting and relaxing like they should? Or is it dead silent? If it's dead silent, that means they're not getting proper muscular activation of the intestines.
Okay.
So I'll go in there and vibrate their stomach and vibrate their intestines.
Have you ever had anybody shit themselves?
No.
Too much vibration.
That's all I can think of.
No.
This poor woman in
Not
there
yet.
just vibrating her stomach and like, oh my God.
Not yet.
Or just past gas or something.
But yeah, that's something. So that's a very tricky diagnosis, and it does take like 3 months, that one, to work through. But it's a combination of supplements, really hardcore diet change and elimination diets to try to
What
clean out
would
the system.
sorry, I didn't mean to interrupt you. What would be some things that people would cut out of their diet, or is it only specific to, like, are there things that you would tell kind of across the board to stay away from?
Yeah.
If you have these issues, or and then what supplements would you take? You're like, I don't want to give away too many of my secrets. I want people to come see me.
Nah, I like giving away the secrets.
Yeah.
I'll do a poop sample.
Yeah.
I'll do it right now.
You're just over there vibrating your stomach.
So the heavy hitters, so the high inflammatory foods, I always recommend patients consider taking out, especially if they have autoimmune issues. Wheat, gluten,
Okay.
dairy, soy.
Okay.
If they're more severe on the health spectrum of issues, you consider eggs and grains.
Oh, okay.
Yeah, but those are usually autoimmune patients.
Right.
So they're struggling with different types of autoimmune diseases, and those are what we restrict for sure.
Right.
to
And
heal
then what
their system.
supplements would you?
For leaky gut type of issues, we put them on. I have a company that I use. That's all pharmaceutical grade stuff, but L-glutamine is a popular one. Aloe vera juice or aloe vera extracts is another popular one for healing the gut. And then vitamin D, vitamin A, omega-3 fish oils, things like that. Those are the basics.
But you do the blood test first to see that they're deficient in those things before you, right?
Yeah.
Okay. Okay.
But those are usually the go-to if we don't have any blood tests.
How do you know if you have a leaky gut?
Well, I think you would know.
Is it like leaky gut?
No,
So
I
like
think it's like
constantly coming
so
out of your
diarrhea.
butt?
No, not
Okay.
necessarily.
Okay.
So the leaky colon.
I'm thinking leaky is like, I think once you did your
Something's
laundry,
dripping.
you would know.
I didn't turn off.
Yeah.
Someone didn't turn off the faucet in here.
Yeah.
So leaky colon would be that. Leaky gut, oftentimes people don't know they have. A blood test will actually show that if you have it or not.
And what are this? What would you? I mean, if it's not that you have a skid mark in your underwear, like what would be a sign that you have a leaky gut rather than a leaky colon?
Severe cases, it's something as simple as bloating or intolerance to foods.
Mm-hmm.
Like if you notice you're developing more and more food allergies that you didn't have before, that's probably a sign you have leaky gut. Like, you know how some people develop food allergies later in life?
Yes.
That could be a leaky gut issue.
Okay.
Yeah.
Huh.
So it's not your typical, you don't have to have digestive signs. It
Right.
could be immunological signs, neurological signs.
Cool.
Yeah.
I should probably do a poop test.
You really want to?
No, I just have okay. I mean,
You're like, do I want to share this?
you guys, I just
I
you
am.
know. No, so I remember growing up, my mom just always had stomach problems. Right? It was like her stomach would always, like, sometimes she'd eat something and she'd get really sick, and it would really bother her, and she never really pooped a lot. We'll come back to how often
Yeah,
you
we'll come back
should
to
poop.
that. Yeah,
But
that's a good question.
I remember I was in college, and I was like, my stomach was starting to, like, bother me, and I just, every time it would, like, bother me, I always thought, like, oh great, I got my mom's stomach.
Right.
Right. And then really it was in 2016 16 maybe. But I used to work with a like a nutritionist for years. I was, doing macros and things like that. And I would have times where like, and I still have this, but I would have times where I would all of a sudden get super distended and like crampy and bloated and retaining water. And the person I was working with at the time was like, okay, out of all the meals you eat in a day, make sure you're getting more of your carbs from vegetables, like 3 meals, and then out of your 4 or whatever. So what I did is I like upped my vegetable intake, and it was in the fall, and I really liked roasting. I would roast vegetables. And so I was doing a lot of like the same vegetables, all the ones I liked. So it was like,
you did a lot of those
squash and broccoli and peppers and mushrooms and onions and leeks and things like that. And it was almost like it just got worse. And so
the plot thickens.
So then I was asked to take a look at the FODMAP diet. And on the FODMAP diet, there was basically, so the idea would be that maybe I was sensitive. I had a hard time digesting high fibrous foods. So things were super like osmotic and pulling a lot of water into your intestine or whatever. And there were, certain ones to like limit, which was like basically all the vegetables I liked.
Eating.
They were all, and I had
the,
just like
on the
upped
list.
the amount that I was eating. So it was like more, it was worse. And then also like gluten and dairy and things like that.
Dairy's a big one for me.
And
I eat a lot of it.
Because before that, like I knew coconut oil is really hard for me to eat. And I remember and if I go out to eat, eating like steak will get me.
Yes, fatty stuff too.
Yeah, super fatty stuff.
Okay.
And it's almost like immediate.
Yeah.
But I remember we had a client at our gym that was a chef, and they would do this like pop-up kitchen once a week, and we'd all go there to support him.
Oh, that's right. He would get sick
and
every
it took
time.
it took me a while.
No, and he was a fabulous cook. She was the only one.
It took a while. Like this happened. It wasn't until I started recognizing like, man, I'm going to come, but I can't eat there because as soon as we leave, I like get distended and cramping and bloated.
Didn't we find out he did a lot?
He cooked everything in coconut oil.
Oh,
yeah.
And did a lot of like fatty meats.
Yeah.
And so I stopped going, but then I just always kind of like attributed it to like certain things, or like Brussels sprouts. Like Brussels sprouts, became a big popular thing on menus at restaurants.
Yeah.
And you'd go and it was like, if I ate them and they were so good that it was like, I knew what was going to happen.
But you're willing to risk it.
And I would eat it anyways. And then I would just be so uncomfortable and in pain like the rest of the night. And it would take like a while for the bloating and the water retention to like go away. And so I started just knowing like, all right, coconut oil, can't really have a lot of that. Don't eat Brussels sprouts unless they're the recommended dish on the menu.
Right.
The special of the day.
Yeah. And, but yeah, I'll have like, that will happen for me sometimes where even, it's happened when I've like gone to sushi.
Fatty fish.
Yeah.
Yeah. So yeah, those are definitely red flags. Something's not right in your digestive system for sure. What your dietitian was doing was she was essentially just guessing, he or she, whoever it was. They were guessing, right? What's great about what functional medicine doctors do, or what I do, is we test to know for sure, right? And we get as close as knowing for sure as we can, so that we have baseline testing, and then we can post-test after to make sure we've actually addressed the problem. But it can be so low FODMAP diet is something we use for SIBO, and it's very strict and it's difficult to follow, but it's one of the few things that helps in SIBO. But the fact that you're not tolerating fatty foods either, it could be a couple things. Could be your gallbladder, could be your stomach's not making enough hydrochloric acid to break down fats and proteins, which doesn't allow the gallbladder to secrete bile to further digest and absorb those fats. Or it could be you have a bacterial overgrowth in your digestive tract, and that's what sets off when you eat, especially with the high fiber foods. High vegetables and fibrous foods are trademark SIBO issues, not tolerating them very well.
Yeah, because I remember one time I had been kind of following more of like the FODMAP, like low FODMAP diet, and I had bought some steel cut oats, and I had been doing like gluten-free for the most part. And the only thing that I had made some oatmeal. I didn't even think, it was like a while down the road, and I didn't even think about, I guess, like that grain.
Yeah.
And it messed me up for a while.
Really?
And like just messed me up in a way that was like back to just being distended.
Yeah.
And like bloated. And
typically it's lower.
Yeah.
Yeah, lower abdomen.
And like
an alien.
swollen.
Yeah. Yep, that's SIBO. 100%.
Sick.
You have SIBO?
Placebo.
Yeah, so
So I need to poop in a hot dog tray.
Yeah.
Or first thing would be a blood test.
or a blood test. Yeah. So SIBO is tricky. We can do a stool test to make sure there's anything else going on. Make sure there's no parasitic infections. Because I did a little research before coming on the show, and I listened to your Moctezuma's Revenge podcast.
So you know that I shit in the Museum of Natural History.
It had me cracking up.
You're like, she may have a little creature in there.
Right? So yeah, it's very true. There may be some underlying parasitic infections.
Going for a tapeworm got me a parasite.
same.
Right?
Same.
So a stool test will tell us that, right? But it won't tell us if you have SIBO. That's the frustrating part about SIBO. There aren't very many definitive tests that exist. There is a breath test that exists called the SIBO breath test. And what it does is it measures the amount of gas being produced by those foods in your breath. So they'll traditionally make either a lot of hydrogen, which typically will cause diarrhea, or they make a lot of methane, which will cause constipation. So depending, to be honest, the testing is kind of expensive, and I've heard there's not high reliability with it. So what I've done now is if you have the classic symptoms, if you don't tolerate fiber and starches, we're going to assume you have SIBO and treat it that way. Save you the money on the test and put you on the program to fix it.
Do they still do that weird tapeworm test? You guys are young.
Oh, with the Scotch tape?
Yes. It's the weirdest thing.
Yeah.
When I was a kid, you would go to the doctor and they would stick tape on your butthole.
Well, didn't Katie do that for? She had to do that for her.
She had that. Her butthole is like a weird.
We won't talk about it. Sorry, guys.
We won't talk about Katie's butthole.
But they probably. So clearly, we know
for
that
tapeworm. They would literally take the tape and stick it on your butthole and pull it off, and then I guess put it under a microscope and see if you had tapeworm. I don't know why they thought I had tapeworm at one point.
Were you so
my
thin?
butthole was itching or something. I don't know. Yeah, maybe because I was really thin. I mean, I don't know exactly. I would say probably 8 or 9.
What are they looking for? What would show up on the tape?
A tapeworm.
The eggs of the tapeworm.
Oh my God, that's so disgusting.
Yeah.
Oh my God. I know. Oh my God. Gross.
Because I think they tend to come out at night. So,
so
the other way I've heard is put the tape on the butthole overnight and then check it in the morning.
Stop it.
Oh my God.
They come out at night.
But yeah, if you have an
We've
itchy
slept
butt,
together so many times. I feel like it's creeping out and crawling into yours.
transmission.
Oh, she looks
no,
fun.
we've never touched buttholes, so we're good there.
We spoon. We don't go butt to butt.
No. Well, the other night we slept like this on our backs, just holding hands.
I know. I hold hands.
You're a hand holder.
This was so funny. I was, and this is off topic, but talking about holding hands. First time, me and my assistant Devin, we were in a hotel and we slept obviously in the same bed. And she told me the next morning, she was like, yeah, in the middle of the night, you like held my hand.
You do.
She goes, it was kind of weird, but I like, you know, I let you do it for a little bit. And I was like, I laughed so hard. I was like, dude, if I fall asleep holding Gina's hand, it like makes me feel better.
On our backs.
Oh man. SIBO.
Yeah, so that's something we can look into.
Sorry.
I have a questionnaire.
She
that I
needs to
give
process this. She was
patients.
just told she has SIBO. Living with SIBO.
I mean, it's a possibility.
Living
I know,
with
It's not
SIBO.
100%.
Right.
But
Living
Living
with
with SIBO. Living with what? Regret?
no. There was something else we said on here one time. Living
Oh.
with cat butthole.
Living with cat butthole.
CBH.
Yeah.
I've got
I've
SIBO
got
and
CBH.
CBH. Talking about when I wake up, sometimes my cowlick.
Cowlick. It looks
Like,
like a cat's
spreads
butthole.
open.
It spreads like this, and you just see the skin of her head.
oh man.
Man. Okay. Well, one more. I'll ask this question, then we can go back to a little bit more chiropractic stuff. Maybe things people could be doing at home for like kind of basic aches and pains that CrossFitters see. But we got there's all these tests now for like food sensitivity tests.
Oh, like the take home kits.
There's
Oh,
these
yeah, I
ones you
never
can
did
buy and they
that.
like send
Yeah.
it to you in the mail and you do the blood test or I did one
Mhm.
and there was stuff like for me knowing like what bothers me, a lot of that food I wasn't sensitive to it.
Yeah.
I was sensitive to chicken and eggs and I was like,
What?
for a long time I ate a
It's
lot
all
of
you eat.
chicken
Yeah.
and eggs and it wasn't until I ate other things that would like I would feel an effect.
Yeah. Yeah, that's tricky. What they're testing for is an immunological response to those foods, not necessarily digestive response to
Okay.
those foods. So that can be different. The other issue with food sensitivity testing is it's not very reliable. I've run quite a bit of like full blood draws, food sensitivity tests, and I get a lot of false negatives.
Okay.
So I don't rely on it.
So probably don't
Yeah.
waste your money on those take-home kits.
I mean, if it's cheap and
Yeah.
you're curious, but it's gotten to the point where I tell patients, don't waste your money on me ordering it. If you want it, I'll order it. But we do a 5-week elimination diet, and we eliminate the high inflammatory foods, which is partially the list that I told you, plus grains, plus legumes, plus lectins, nightshade vegetables.
My favorite.
Especially,
are.
well, that's especially for autoimmune patients. And then reintroduce one food at a time, one food every other day. And what happens is during that 5 weeks, your system sensitizes to it. And when you reintroduce it, if you have an issue, you're going to know right away. So, for example, I did it and I cut out eggs, which I was eating like 5 days a week, eggs. And when I reintroduced it, I noticed I would get like a phlegmy cough and a little bit of congestion immediately after eating the eggs, and then it would go away. So that just tells me I have some immunological response to eggs. I limit my exposure maybe twice a week now, and it should be fine. If you alternate your foods, like eating seasonally is important. If you alternate your foods, you decrease your chances of your immune system reacting to those foods.
Oh, okay.
But a lot of athletes, what they do is they
Eat
have
the
their
same
favorite
things
foods.
all the time.
Exactly.
'Cause
And
it-
they stick to them.
Yep.
Right. And they know the
Which-
macros in them, so they're like, oh, I can
Exactly,
eat this every day
exactly.
and this. And yeah.
But you can
Right.
increase your risk for developing sensitivities to those foods
Oh,
over time.
okay.
Maybe that's what I did.
Yeah.
So
I did eat the same stuff
Yeah,
for a
yeah.
long
Every day.
time.
Yeah.
And this is stuff, I've been working with Marissa a lot with. And so I say eat seasonally. If you eat seasonally, it's perfect because if you go with the seasons, your food choice, your vegetable choices will change. Right?
Okay.
And that's healthier for the gut and the variety, and it's healthier for the immune system as well. Right?
Yeah.
And one of your questions you're going to ask is how often should you be going to the bathroom?
Yeah.
right?
Yeah.
I wanted to come back to that
Because lots of people have different answers.
yeah.
Everyone's like, everyone's different.
Right. So so get this. I had a patient come in. She tells me she has a bowel movement once every 2 weeks.
Oh my gosh.
And this has been her whole life. And she's in her 70s. And I look at her and I was like,
What?
have you talked to a gastroenterologist about this? Oh, yes. They say it's normal for me.
No.
And then, okay, get this. I get another patient who comes in. She tells me she has like 8 to 9 bowel movements all within a 2-hour period in the morning. I was like, did you talk to your gastroenterologist about
Right.
this? She says, oh, yeah, it says it's normal for me.
Is she like always late for work? Like,
Right?
You know what I
Or
mean?
She spends most
That's
of the
so
morning
much
in the
time.
bathroom, right?
Oh my gosh.
So I was like, okay. Moral of the story is we got both of them going 2 to 3 times a day regularly. That's normal to me. daily.
Yeah.
Yeah.
At
Okay.
least daily.
Oh, I'm not
And
normal.
like over 3 is probably not very good.
Yeah. Huh.
Yeah. So daily, at least.
There was a
daily.
period of time. I'm what you would say is normal. I'm a lot more normal now.
Mm-hmm.
But also after taking so much time from like surgery and injury and taking the years off of training for competition, I wasn't training as much. So I changed how I was eating. And now I feel like I'm probably more like normal, but still have sensitivity with certain things.
Mm-hmm.
But there was a period of time where I went to I pooped probably like 6 times a day.
Oh yeah, that's not normal.
I'm jealous.
Constipation is a common issue
Yeah.
for women.
Yes. That's me.
Yeah.
Mm-hmm.
Like
I can
my
go
mom,
days.
if like my
I mean,
mom will
I
go on a
wasn't
trip.
pooper every 2 weeks, but
My mom would go if my mom goes out of town, she
I'm the
won't
same
go
way. Yeah.
the whole time. I'm like if I don't poop at least once a day, I'm like
Yeah.
something is wrong.
Feel
Right.
shitty.
Yeah. I feel exactly
Full of shit.
Yeah, you're full of shit.
My
for
eyes
sure.
turn from blue
Yeah,
to brown.
That's why mine are brown. My eyes are actually blue.
Man, we got to get that poop out of
It
you.
only shows up, every
The old rope.
Yeah. Oh my God, the old rope. Oh my
But
God.
it's a big issue. Big
Yeah.
issue. And so that's when we have to look into, well, what's the underlying issues? 1 in 4 women has a thyroid issue. Right?
Oh.
Thyroid directly correlates to poor digestive function, right? So that's why I do a lot of blood testing to figure that out. Otherwise, you could try to fix the gut all day, but if a thyroid issue is driving your constipation, then it's never going to get fixed.
Okay. Huh.
Right? So there's a lot that goes into the gut stuff, but
Yeah.
it's been pretty popular among the CrossFit athletes that have come
Yeah.
in.
So not only do I need to do a poop test, so do you.
I know. Or something. I need to do something. Well, I'm going to have to catch it on the right day.
For real. You got to time it.
I need a long time limit to get that poop test in.
I don't really know when it's coming, but
Yeah. Oh
just
my
keep
gosh.
the just keep
Yeah.
keep the test close by.
I was supposed to have this turned in,
All right,
4
well,
days ago.
okay, well, we are obviously we'll check back on some neurological
poop.
stuff for myself and on our gut health with me and Gina.
Yeah.
But to wrap it up and bring it back full circle, in CrossFit, you see, well, I'll speak for what I would know or as a coach, like you see a lot of pain or lingering things start to happen in the shoulders, low back, knees. But you hear a lot about shoulders. And I always think too, a lot of people, if they're not, we do everything from a front rack. There's so much from the front rack, and we do a lot of things in this plane.
Mm-hmm.
As far as, I guess can you give us like one exercise or one thing that you would maybe recommend for people to do, speaking about CrossFit, for the shoulder, the back, the knee?
Good question. Let me see. I think the biggest issue is mobility.
Mm-hmm.
So working mobility, doing ROM WOD consistently, those types of things. Usually my go-to for people is, aside from mobility, or thoracic mobility is another big one, right? But usually my go-to is the crossball or foam roller, almost all the time. For shoulders especially, the back of the rotator cuff, where people tend to get a lot of pinching, working through there, and then the subscap, which is the muscle basically in the armpit.
Mm-hmm.
The subscap is one of the biggest muscles that actually wraps around the entire shoulder girdle and keeps the shoulder back and down in its socket. I don't think the subscap gets enough love with myofascial release or mobility things. Best way to work that, honestly, it gets worked a lot with bench pressing and push-ups.
Mm-hmm.
Keeping it soft and mobile, I think, is the big issue. So having someone get their thumb in there and just like shred it apart helps tremendously. And that helps balance the rotator cuff from the back to the front as well, and keeps it strong and engaged. So that's big for the shoulders, in my opinion. But sometimes you just can't get away. If you're lifting heavy and if you catch wrong, I mean, you could do all the mobility and prep training you want, but if you catch it wrong, it's gonna injure the shoulder.
Yeah.
Right.
For the low back, glute and hamstrings strength, so oftentimes neglected. So the glute ham machine, which we had a conversation about, that is great. I think that's a great machine for targeting hamstrings and glutes, because the hamstrings and glutes really stabilize the low back and keep it strong. That's one of the big issues I have with general population or with the tech people, is they sit all day, their glutes don't fire, they don't activate, their hamstrings are weak and don't activate, and they don't stabilize the low back. So sometimes some of the CrossFitters, we have to take a step back from the heavy lifting and focus on rehabilitating their glutes. And sometimes there's one glute that's just way weaker than the other. So we target that glute, and then the hamstrings, targeting those, especially for the low back. And then what was the other one?
Knees, which is probably just an issue from the same stuff,
Yes,
right?
yeah, exactly. Hips and glutes stabilize downwards to the knees. IT band issues tend to be radiate into the knee as well. So I tend to look at the IT bands a lot, and then the glutes, the lateral glute muscles, and work through those. Yeah. So you got your banded walks, which are pretty popular. Lateral walks. You have your forward and backward walks to work the glutes, the lateral glutes. You have like your glute raises, your bridging exercises, basic stuff.
Man, I do those all the time.
Do you?
Yeah, I'm a big air humper.
Superman's.
Yeah.
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 It's probably, that's what's keeping your back stable, probably.
Yeah.
Right? So those are things I talk about to people. If they're doing them consistently, you shouldn't have low back issues, unless, again, you're doing like a max lift and you just fatigue sets in and then something tweaks.
Right.
And then just take the proper rest that you need.
Yeah.
Don't be a hero.
Yeah.
Exactly.
Don't go for that PR every time.
Yeah.
It's a
Right? And
common
check
problem.
the ego.
Yeah, you
exactly.
definitely have to check the ego. I do it all the time. Stopped like training full time, like to go to the CrossFit Games, to be a CrossFit Games athlete. And I definitely find, well, I'm training right now, so I don't get to do it as much anymore. But I would go to the gym, and it's like, if something didn't feel good, I just go,
Nah,
Yeah.
not gonna do it.
I'm not going to do
Not
it.
worth it.
Yeah.
Not worth it. I feel good.
Yeah.
Do something else. I'm just going to hump the air. Gina.
Just over. I call it. It's like I go in like the room of shame. It's like, because we have some pretty strong athletes in our gym, and so I'll end up like going in the other. I'll like look at my programming, because I've had so many different injuries, and I'm like, oh, glute bridges again. Okay, I'm gonna go in the other room, do it by myself, and then people will come in. They're like heavy deadlifting and like all this stuff and like back squat, and I'm just over there, just, hey guys,
Yeah, but your butt
pump in
looks
the air.
great.
Oh well, thanks, thank you.
Right.
Working on it.
More people should be doing it.
Good to know.
Absolutely.
Well, thank you so much.
Yeah, thanks for
absolutely.
coming.
We'll have you back on.
Enlightening us.
Yeah, we're going to have you back on to talk about some
Some more female issues.
female stuff, which would
Yeah.
be really great.
They have big things to talk about in the office all the time is poop and periods.
Yep, periods is next.
A lot of
I mean, I don't
female
have
health.
one
You
anymore.
don't know anything
so-
about that.
Yeah, I don't have one anymore, so I don't have to worry about it. But we'll do that episode for those of you who do.
Yeah, we'll talk about that.
Yeah.
But
So
thank you.
yeah,
Yes,
thank you for
thanks
coming.
for
It was-
having me.
Yeah,
Awesome.
nice
And,
to meet you.
We did. I feel like I'm pretty proud we didn't get off topic too many times.
No, I think
It was all relative.
I think we stuck to it. We stuck to it.
But guys, thanks
Yeah.
for listening.
Don't
Remember
forget
to rate, review, subscribe.
5-star rating,
5-star
warning.
We'll talk to you next week.
All right, bye guys.
Bye.